It's another good day to remind you of the different ways for you to stay healthy, and also to tell you that staying healthy is the best life decision you can make for yourself and your loved ones. Welcome to Nonye's Healthy Living Show, your trusted platform for insightful conversations about your health and general wellness. Today, we're going to be looking at something that has the potential to save lives but is often overlooked. And what are those? Medical checkups. Do people in this part of the world pay attention to going to the hospital for one health check or the other? Do they even do that? Do they know that medical checkups could be your first line of defense against silent killers? That is why today on the program we've decided to touch this sport that is often overlooked, but people do not know that it has the potential to save lives, like I said earlier, and that is medical checkups, your first line of defense against silent killers. I am Priska Wanko, and of course, joining the conversation today on Nonye's Healthy Living Show. Yes, I'm the anchor, but believe me when I tell you that there are better qualified individuals that are here to educate us about the importance of going for regular health checks. Joining the conversation today, it's my privilege to welcome Dr. Uchenna Terry, KK, medical practitioner. Dr. KK, welcome to the Nonye's Healthy Living Show.
Yeah, thank you. Welcome, listeners.
Thank you. All right, in the same vein, it's also my privilege to welcome Dr. Peter Anirubi, a medical officer. Dr. Peter, welcome to the show.
Thank you. Thank you for having me.
And it's a pleasure to have you. All right, just like I stated earlier, I said that we would like to talk about medical checkups as a first line of defense against silent killers. But I think it's very important when we go back to the basics to understand what these health checkups or medical checkups, as the case may be, what it's all about and what it actually means before we now start looking at if it's something people should, imbibe the habit of doing or not. So I'm going to start with Dr. Okeke to give, for the layman, when we talk about, we're not medical workers, so when we talk about going for health checkups or medical checkups, what do we actually mean?
Yeah, thank you. Medical checkup as a matter of fact, is a visit one makes to his or her health practitioner, be it nurse or doctor or laboratory scientist, in order to ascertain the overall well-being or health of one's health. Just on a nutshell, what's medical checkup? At the end, to prevent diseases and promote healthy well-being.
Okay, is there a time frame that one should go for a checkup? Like what time, at what point in time should one be going for a medical checkup?
Yeah, it depends on the what one wants to achieve. There are types of checkup. You have the routine checkup and the wellness checkup. These are the two major types of checkup we have.
Okay.
Although there's another one they call the specialized checkup. But the routine one doesn't really, it depends on age as well, the gender, but it is all encompassing. Whenever you feel need to go to see a doctor, even when you don't have any disease, when you're at risk, when you're not at risk, or when you want education, well, that one has to do the wellness checkup. Health promotion, just go and talk to allay your fear, discuss with your health practitioner, and even when there is something bothering you, when an information is not clear in your head, you can just walk in and have a checkup. So the routine one is the one that goes to detect diagnosis and treatment options.
Okay.
But there is no, but generally people say go age bracket, go once in 2 years. When you're getting
Once in
older,
2 years.
when you're getting older, you go yearly. When you are now at the extreme age, 60s, 6 decades of life, you go 6 monthly, especially when there's a chronic illness.
Okay, so talking about chronic illness, what if you do not know that you have some kind of chronic illness? Is it not something that a health checkup ordinarily should detect?
Okay, thank you. The truth is that some persons may assume they are okay. Following what you just said now, some persons may assume they are fantastically okay. Of course, they don't know they have chronic illness. It is this health checkup that will help you detect that actually there is this impending doom. If not for the checkup, you wouldn't have known. So it's important to go for health checkup because you'll be able to identify these risk factors that will push you to a particular disease.
Okay, let's say I want to go to the hospital right now for a health checkup. What are the standard tests that I should be looking out for, or I should be, telling the medical practitioners, what am I going to check for? I want to go to the hospital. Are there routine tests that is required for a standard routine check?
Okay, fine. Thank you. Just like our chief rightly said, good. From the time you enter the hospital for a medical checkup, normally, one of the things that should be done is that the nurses will have to begin to check your vital signs before you see your doctors. You have started the checkup already. As you've come, they'll begin to check your vital signs, your BP, for hypertension, your pulse rate, your respiratory rate, your temperature, your weight. This helps us a lot in assessing your health. Of course, it forms part of the checkup as you have visited the hospital. Even when you come to the doctor's table, these vital signs, some of them may be confirmed, like you will need to recheck, especially that BP. Then, other things that you will obtain when you come for medical checkup. We'll check for cholesterol, because some people don't know that there is a whole lot of things high cholesterol can do to someone. It can give you a whole lot of illness. Then we'll also check for your sugar level, your mental health. We'll also check for your dentition, and all whatnot, as the case may be. Then, going forward, there are many other screenings that follows the checkup, like for women, for men, when they begin to do routine checkup, like men checking for their prostates, women checking for lumps, maybe breast lumps or cervical cancer, as the case may be. There are a whole lot of things one can benefit when the person comes for health checkup.
Okay, looking at our society, would you say regular health checks is something that people in this part of the world, is this something that they actually pay attention to? If it's not, why?
I hope it is interwoven.
Interwoven, huh?
Yes.
Okay.
Some people that are knowledgeable, some know about benefits of checkup. Those that are on the other side of the
Spectrum.
river feel, well, I am okay, I don't have any particular problem. And then there's this balance. People used to say that nobody is healthy. So and if you want to find something, if you want to start seeking or looking for, you will find, you must see
something.
That's why go to stress yourself. Some people really don't go for those checkups. And then holistically, awareness, finance, some people see it as waste of money. I imagine you go to see a doctor, he consults, you follow with him, you go without prescribing a drug for you and still charge you. Why would I go? or there's a little test or 2 or 3 they do, and he comes and tell you you're okay. So, and you see that you wasted your money. Why did I go to do checkup? And eventually I don't have any, there's nothing found on me. 3, the fear of getting a bad news, maybe. So people really, there are more than I'm sure, more those that go for checkup than those that.
Oh, you're saying that there are more people that go for regular
Sure,
health
because
checks?
of the awareness now. There's awareness. There's insurance going on. Some organizations, some Nigerians, affluent individuals now come to do free screening, especially during Christmas or during political era. Everyone is trying to do medical checkup, screening and promotion. And then use of social media, people now know about diseases and illnesses, as it were. So, and moreover, once comes to the hospital, the next appointment is always come for checkup, as a routine one. But the wellness one I told you, people really don't do that. It's more the decline. Yeah, and then the specialized type. So people go for checkup, but not regularly. I'm sure 1 or 2 persons in a family must have gone every family must have gone for checkup.
Okay, you mentioned social media. Okay, so and apparently social media and technology is meant to make things better and easier for individuals. But some persons will tell you that if you want to die faster than your near date of death, that you should avoid Google. When you start presenting with some symptoms, some people first of all go on the internet and start checking it out. And sometimes when they see some of these things, they start getting worried. And they become scared because of all the things that the internet has already told them based on what they're experiencing. So is that the right approach?
Is that not there? For my patients, I always even advise them
to go to Google?
Just read about your problem. It is not a query. It's supposed to be a conversation when you meet a health practitioner. You discuss, not answer question, not a query kind of.
Are you talking about the online or the physical?
Online. You read a leaflet, you read journals, you read newspaper, you go online and read and know some of the frequently asked questions about your disease, a drug that you've had before. Sir, this is what people say. This is what I read. Is it true? Is it correct? This is what the symptoms I'm having. Do you think I'm having this? It is the job of the open communication to disabuse your mind and tell you yes or no, or this is the correct. If you are oblivious of what is wrong with you, you don't even appreciate when your doctor or your health worker advises you on what to do. So, but which sites are you going to get the information? Matters. Okay. Is it the proper channel? Is it everybody can go and write anything and post online? So it has to be a verified site or source. And then have an open mind. If it is there, it is there. The next step is what can be done.
But Doc, is it really possible to have an open mind when you have seen, when you're having some symptoms and Google has told you that this is that, maybe something that might even require a surgery or something that is life-threatening? Can you still have an open mind in that kind of scenario?
That's why they have psychologists. They have, social support system. Have a friend, have, peers that will talk you into having that open mind, and this is not the end of life. Even if it is, there's sometimes disease that terminates in terminal diseases, but still you can live a healthy life while managing your terminal diseases. Enjoy yourself, being a little independent, and then explore the world as you've never been. So, although I know some depression, anxiety will set in, anger and the rest of them, but at the end of the day, with the help of the social support and psychologists and friends, peer, one obviously will get over it. And I believe in that as a being, that is superior to all man. So who knows?
Okay, so your problem is, I mean, you're saying that the problem is not social media. The problem is basically where you're getting the information from
And how you interpret it.
and how you interpret the
I
information.
have something to add.
All right,
to
go
that.
on.
Yeah, please. There is this a friend of mine.
Okay.
Somewhere, she works in the lab. So funny enough, she easily tests herself. She can easily get some tests, frequently. Now, she continues doing full blood count. Chief, when you do full blood count, there are many parameters you see there. So she's not a doctor, she's not a nurse, she's just a lab scientist. So she now brought one of the tests to me. Before she brought it to me, she had gone to the internet and started browsing each of those parameters, neutrophils, all of them. Then she became worried. She thought she had HIV. It started weighing her down. So luckily, she usually talked to me, so she came, and she came with the result. That look at this, so and she don't understand. And she has done HIV tests regularly, but negative, still negative. But then these things are telling you that if you browse for HIV, you will see things equivalent to the raised those parameters that she was seeing. You understand? She had already started seeing herself like someone who has
HIV.
Wow. So the issue now is, I believe that one can go online, just get knowledge, but at any point in time, go to your doctor for some interaction. You're free. Of course, you cannot tell someone not to go and browse about anything. It's good to have information about, but go to the hospital and have a bit refined information about that stuff. Thank you.
Okay, all right. Okay, let's talk about gender and age-specific screening, like those health checks as it relates to both gender, male and female. And I know you mentioned breast cancer and cervical cancer. Are there other screenings women need to look up for when they get to a certain age that is important for them to test for when they get to a certain age for women, beyond cervical cancer and breast cancer?
Oh, yes. Yeah, basically, when a woman begins to grow, after the menarche, you will notice at a particular age, that woman will begin to engage in sexual intercourse. Even before that stage, you will look out for some infections, like urinary tract infections. You screen for this. Then it goes on when the woman gets to 21-year-old. She should go for cervical cancer screening, pap smear. You do pap smear. At least you can do that every 3 years. Then when you get to 30, you can also inculcate that of HPV, human papilloma virus. That you can do every 5 years. If you want, you can be doing it together with the pap smear. Then at age 40, you can go for breast check. You're looking out for lumps, for possible cancer, doing mammography. Then, as you age, when you reach maybe 50, you can now go for colorectal screening for cancer, for colorectal cancer. So this basically a woman should engage in.
Okay. All right. What about the men, Dr. KK? What test should they be looking out for, and at what age?
For the ladies.
For the ladies, okay.
For the ladies.
Okay, what are they?
I think he's right.
Okay.
The advocacy now should be those that are high risk. People should not say, not my portion. Not my portion.
Okay, high
those
risk.
Those are high risk. Those that are environmental high risk. those that have had one or two cancers in the past.
Okay.
Those have had a close relation with the
Okay,
cancer.
genetic factors.
Yes, so
Okay.
they don't need to wait that long. They could
Okay.
go, some even say 10 years. Assuming the lady A has cancer at 30, it's immediate relations. Should start screening
Early
at
enough.
20.
Okay.
There's a law that says 10 years below the age at which the youngest family member has any cancer.
Okay.
Like if he's 21 and someone is diagnosed of breast cancer or colon cancer at 21,
He means that from a
the
little
people in the house should start screening at 11.
Wow.
Yeah.
Because for it to have been detected at 21,
Yeah.
it's probably maybe 5-6 years ago that it started.
I started.
Precursor cell before stage 1. So that's that. The amount, thyroid, there are many age-related
For female.
endometrial cancer, breast.
Okay.
Even to ladies, once they start that menarche, start checking for breast self
Even
examination.
what's
The
menarche?
menarche, they at age where a woman sees her first menstruation.
Okay.
They
Okay.
start checking at least that each monthly, check for breast lump. Use your hand, put tension on the breast muscle and check. Even for guys, the young ones, check the testicular, the hold of testes, scrotum, and check for testes for firmness or pain or consistency as if it's smooth. As for male, as that at adolescent age. As they're not growing, infection like it's HIV, hepatitis, B and C. And then prostate when you grow older.
For the men.
For the men.
Okay.
That is with the first 2-3 commonest silent diseases: hypertension, diabetes, other heart diseases, chronic heart, myocardial infarction or CCF, and then lung cancer as well. So then when they get older, colonoscopy, like you said, for the female, same for the male too, for the colon and rectum, even the sigmoidoscopy for cancer of the, in short, in males, the highest killer of cancer, male cancers in men, prostate, lung, and colon.
For men?
Yes, just like you have breast,
And cervical cancer.
colon, and prostate.
Okay.
And it's deadly.
Deadly.
The whole, whether gastric, whether stomach, the colon.
So that's why it's advisable for
Yes.
them to keep. So family history and genetic factors, you can
And
predispose
lifestyle,
someone.
if you drink, if you smoke, if you don't exercise, you don't, and, if you have any other comorbidity, you have hypertension or diabetes, or any other sexually transmitted disease that can equally predispose one to having a certain cancers.
And you cannot know that you have all these things now,
If you
else
don't
you
go for
go
checkup.
for the health checkups,
Yes.
which is what we are saying.
Yeah.
Okay, so are there also health checks that are also essential for children?
Yes, of course. For children and teenagers, you begin to check about their growth. Okay, before I get to that, it's also essential that you do some blood tests for your child. Check for sickle cell, check for hepatitis B and C. Then it's also not bad if you do the kidney function test, the liver function test. Then for possible abnormalities, when you take the child to the hospital, they begin to run through all the body to be sure there's no hidden abnormality. These are part of checkup you do when you come for medical health check. Then they check for their vision, for their hearing. There is hearing test that should be done for a child so that it can easily be detected if there's a problem. Dentition, and if it's possible, you carry. We've talked about the urinary tract infection, both male and female. Any of them can have this. So these are also part of tests you check for
Okay.
children.
All right. I want us to look at some things that might act as a constraint to regular health checks. Like, why do some people find it difficult to go to the hospital for those routine checks? Is it because of the finance? Or is it just because they feel that they want when the symptoms start manifesting? Or because they feel comfortable waiting for the symptoms to start manifesting before they actually do something? Or is it just because of the financial constraints?
No, not because
None of the above.
there's nothing that is only there's nothing that is absolute. You have the primary reason, the secondary, and the maybe tertiary.
Okay.
The primary is decision to go for.
So you need to
Make a decision.
take a decision. Okay.
Do I need this? Have the awareness, want to go, and then where to go. If there's no hospital around you, if there is, and for whatever reason, you are not allowed to go there. Some people sometimes have communal clashes. They say the people from this town should not go to this hospital in this town, even when it is so close. They say, because even within the village, the village will have clannish, whatever. So that can affect. Then, when you really want to go, some cultural intricacies. I want to go for job, but my brother is not around, or my husband is not around to allow me to go, culturally or religious. There's some of the. Then when you decided that you want to go, what about the road? Is rainy season? Can the road is not reliable, and you get there? If it is, and when you get there, is the manpower as the doctor there? Is he, even if he's there, is he overworked? Or you come by, then whatever you are going to use, is it available, water or reagents, and then the waiting time. Some can come and 30 patients lining up for one nurse, and then some language barrier communication. So I speak Igbo, the corporate doctor there speaks Hausa, he doesn't understand what's the sense of going there. These are some factors. And then the relationship, last time I went there, how was I treated? What was the relationship, interpersonal?
Relationship.
Just go, okay, every time you keep coming to this hospital, is it your house? These are. And then, when you now go, the fear of whatever the news outcome, the stigma that may even come with it. I see this man walking towards the heart and heart. That means it's probably HIV. He wants to go and check what he has. Or I'm seeing him walking into the psychiatric hospital. Maybe he has issue. I know that's his father used to have mental. Then probably he's now having. These are the stigmas. These are things that may make one not want, not only financial. Then some people, maybe when we get to, or the third, you want to go, you've gone. Then, after the screening, the results, how is it being interpreted? The person that does it is knowledgeable enough to carry out this, so these are some of the factors, not purely
Financial. Okay. What do you think?
Yeah, actually, all he said is in order now. Yeah, and one thing with our people is understanding that health checkup is very important. Agreeing that it is important to actually go for checkup. One thing is, you can come to the hospital and observe that many people will be like, please see me, I'm busy, I want to go back to my office, I want to go to the market, please see me, I want to take my child to school. They will be worrying you to see them faster. That is to tell you that people don't even have time to go and spend in the hospital. So knowing that it is good to go for checkup is one thing. then you plan for it. But you see people, they don't even understand, they don't even believe that it is necessary to go for checkup. So in addition to all that you have said,
Okay, do you also think, Doc, that fear and anxiety about what to expect might also be a barrier to people seeking to get regular checks? Because they're scared, fear of the unknown. If I go now, they will see something. I don't know what they are going to see. Do you think it's one thing that deters people from actually going for these health checkups?
Yes, it is. It's one of the factors. Even I can personalize it at a point in my life. I've done colonoscopy
Oh,
because
wow.
of family history.
Oh,
After and I was told to come and get my results. I didn't want to go. I was just, okay, let me wait. Let me finish also. That's something I was planning.
in case you see bad
So
news.
if it starts now, should I wait next month? And I asked myself, I would have lost a month if it's positive. And the next thing is, it is natural, it is there. So that's why I said the social support, psychotherapy, taking that decision and knowing that it may be late, but it is not it's never too late to start. Go, and so that fear, stigma, that was self, that was self, self perceived stigma.
Okay. Not the one that somebody is imposing on you.
Not, you just, how will I live? What will I do?
So fear
What
of the
will
unknown is
yes,
preventing you from knowing.
yes, but you have to fight it, knowing that it is better, it now than next 2 years when the prognosis is even
worse.
And then some diseases are not terminal. You can manage hypertension, is manageable, diabetes. You can live your life with that. You will not decide to make a life, modify your lifestyle. Wash your hands, do exercise, cover your face, wear nose masks, and then take medications. And, this guy, you remember this year, 2025, WHO health team.
The HIV stuff?
Not HIV, general,
Withdrawing funding, yeah.
Global support for universal health. Global
What else
action.
organization? Yeah.
That's 20.
The
So
team.
there's now a global action for universal health for all citizens of the world.
So money will not be a problem.
Yes, preventive medicine approach. The federal government now has even brought up a national emergency medical and ambulance system for every Nigerian. Former President Buhari signed it while he was living. It is now a law that every Nigerian should have an accessible health coverage that is free.
Is it?
At least for vulnerable people that are poor and even and uninsured.
But how practicable? Is it working?
And it is working in Anambra State.
Yeah, of course. Anambra already even has a state health insurance. Anambra has a state health insurance scheme, yeah?
I'm talking about the Anambra State
Universal
medical emergency service and ambulance system.
The ambulance system, yes.
For any medical whatever checkup, or just go to the hospital and be treated free of charge for the first.
Yeah, we know it's working in Anambra, but the question is, there are 36 states in Nigeria. Is it working there too?
Yeah,
that's the problem.
It is a counterpart funding.
Because that's the problem.
The state will show interest before the federal government
will come in and assist.
So Anambra showed interest, but the legislation is still poor. Awareness. I'm sure none of you here know that as I'm sitting here, if I collapse, you have to call 112.
We know that they do come to the station to do programs.
But let this be an opportunity to let
people know,
and even people living in other parts of Nigeria and the world to know that health is wealth. Always be at par with information online.
Please, I want to add something. When we talk about a negative result, I see that a result that is okay for health checkup. If you come to health checkup and you get to know your status, you assuming it is a good result is dependent on how you view it. For instance, let's say you never knew you have hypertension and you present, just normally you just came for a checkup and they identify that you actually have raised BP. You may be angry, you may be annoyed, you may be sad that you have elevated BP. But in the other way around, it's a good result, because had it been you didn't come for that checkup, believe me, you may be a victim one day, that you'll be brought to the hospital as an emergency case. So the result, you have hypertension detected, you are seeing it as a negative result. But somehow, you should also rejoice that this has been identified as early as possible. Yes, because for those who have diabetes, for example, you never knew about it, just know that as far as you have diabetes in you, it's not just like a time bomb. It's ticking. All the complications of diabetes may begin to come in, and this cannot come if you begin to check up on time. If you find out you have diabetes early enough, those complications may not actually arise because you begin to take care of them early enough. So it's still part of...
In other words, you're saying that ignorance of a pre-existing health condition actually makes it worse for you.
Of course.
Like if you're deciding to wallow in ignorance about your health condition, that's actually worse for you, because it will keep growing, it will keep being there.
Of course. Some people will tell you it's not my portion. I keep asking the question.
Whose portion is it, really?
A doctor can be sick. Reverend fathers can be sick. Pastors can be sick. The chronic illness can come to anybody. So it's not as if you're being told that, sir, ma, your BP is very high. You'll be saying, no, I don't have BP. But they are telling you that your BP, look into this. You said it's not your portion. But when it to be a portion, you will still come and be a problem to the hospital. So it's good to go for checkup.
Okay. All right. Now, Doc, so, when I was entering secondary school and even the universities, there were compulsory tests that were made to on the go. Like you check your blood, you do X-ray, you check your heart, check your kidneys, liver, in fact, the works. The full body test, we did it in secondary school, and I also did it before I got into the university. So what I'm asking is, if, for instance, maybe employers, people working, owning companies, if they make some of these health screenings compulsory for the people working for them, and replicating this kind of scenario in other facets of human endeavor, do you think it could actually change the narrative and make people pay attention to regular health checks?
Yes, it sure will do. I'm sure no government in Nigeria employs anybody without medical certification. But is it regular?
But that's the problem, and also in the
Just
sense of
once.
medical certification, some people might just go to the hospital and
Because
get it.
I'm
With
sure
no check.
the medical doctors frown on it, but I'm telling you that most people that do, when they come to ask, it is about money, finance now.
Yes.
So say, well, I don't have money to do all this. Doctor, do this, check this. It is not you that will. It is the doctor that checks and determines from the question and answer, the interaction, you know which one is apt at a particular point in time, considering your age, your sex, and the type of work you are applying for. But no doctor signs that medical certificate without doing that. I'm sure I'm telling you, some may be quacks on the gate acting as doctors, or other people that claim they're doctors. Because you know the implication, you are signing your number and your signature without necessarily
Doing the...
So this is, we frown at it. But most essentially, it is not cast on stone that this is the lab or the that you do. They are bound depending on the system. From position from the eye down to the toe, all the systems in the body. But there is this, but the one they call the vital signs. Vital means important that you can use to find if there's any other disease anywhere. The BP, the heart rate, these are there are about seven of them. That could show incidentally what has been there that you didn't know. And you thank your stars. If not for this, I don't have. Then the government, the employees should insensitize, persons every year before end of year Christmas. Those that have gone for, you just start them by January and allow everybody by December. Those that are going to give the bag of rice are those that have gone for medical checkup this year once or twice. You don't make it a policy. And then encourage everybody to register health insurance. It saves costs. Some could do retainership, some companies, office can do retainership with a particular hospital, and freely before you go for your leave or your by the time you come back for annual leave, come back with your medical. Let it be a policy, not to drain their pockets. And always, if someone tells you, "Sir, I want to go and do, I'm not sick, but I want to go for a medical checkup," allow the person if it's 1 day off. Let it be. Allow. Some people say, "I want to go, but I don't have time in my office. I work and work and work. If I leave the office, everything will collapse." Just know that when you die,
everything will still work, whether you're there or not.
The boss's employers make it a policy. Allow people to encourage. In a better scenario, you can even invite the medical team
to come to your
and do those
screenings,
ECG or breast, a holistic, and then even if it means paying from out of pocket, you can spread it within a year. But let every Nigerian know the benefit of doing that and registering for
health insurance.
And then those insurance companies should probably have a package where some type of premiums they can even say, okay, you pay 50%. This is not in the package, but since you've shown interest of your customer, your client, there's a way to, and then Christmas, whatever bonus should include regular health checkups. Free for your employees.
Okay. Do you think that having a personal doctor could also help encourage people to be going for routine health checks, like having a family doctor?
Very well.
Will it help?
Very
Is it an
well.
essential thing with regards to what we're discussing?
Yes, it will help. That is something Chief was explaining earlier on. When you get cool with your health practitioner, it will help you to, you find it easy to communicate, to visit hospital. When you get to know that this person gives you listening ear, you have known this person, you know
over
how
time.
he talks to you, you tolerate the way he rules about seeing to your health issues. When you enroll your family people to that particular hospital for that doctor to be seeing you and your family members, it goes a long way to ease tension. And you can also choose that from time to time, if you so wish, your doctor can come to your house to just have some things checked on you, the BP, the sugar, and all whatnot. It depends on the arrangement. But having family doctor is actually good.
Okay.
It helps, yes.
All right, Dr. Kike, you said something about being scared to go and get your test results when you did the colonectomy, right? Colonoscopy. Yeah, okay, so what I want to ask is, when somebody receives a result, like a negative test result, what are the steps the person should take? What do you do? Like negative, I mean is, you went for a routine test, like probably you did for your colonoscopy, and of course you're expecting good news. But what if at the end of the day, it turns out that it's not the good news you're expecting that you got? What are the basic steps that these individuals can take?
Yes, if one of the steps is asking yourself before stepping into that office, what
will happen if
it's good?
If it goes this way or
what
that?
Happens? How do I stay or keep staying good?
If
it's bad, what do I do? Don't give yourself a fault. Say, it is my fault, I should have come earlier, or I shouldn't have indulged in one activity, or I shouldn't have been eating this. It's also good. It's like I said, it's never too late. This is when you wake up is your morning. Go with someone.
Even if you wake up in the
you have a
night.
low threshold for crying, go with someone that loves you. Your child, your colleague, your work, any social work or whatever.
There is a support system.
Go with the hanky. Go with the water. Take a deep breath, and then let it be a doctor that you already know, or you already acquaintance with, and you can look into
That can
eyes
break the
yes.
story to you.
And
I mean,
then,
break the news to you in a
yes,
subtle manner.
and then whatever, if they tell you have hypertension now, someone will cry. But just know that it's not the end of life. They tell you have a hearing, like we keep saying diabetes, and the other ones, hearing loss, 2 decades, mental, depression, anxiety, substance abuse, all whatnot. And then ask, person is, ask questions. Doc, this is what it is now. Can you give me these test results? Can you tell me what it is? I'm able to ask questions. Ask questions. You can even seek a second opinion. Most doctors will tell you, okay, please go to another hospital and check it. Knowing that there may be error. Human error or technical human error. Or just to double check. So something can be 7 and you go elsewhere and it becomes 6 or 8. That does not negate that 7, but maybe it's getting better.
Okay, talking about getting a second opinion.
Yes, and then have an open mind, ask questions, and now discuss treatment plan, modality. Where do we go from there? How often do I have to check this? Can I? What are the life changes? Like His Excellency advocates that those like less alcohol, less salt intake, let's do more of exercise, take vegetables, eat healthy, have a good sleep, exercise, do yoga, and then when next do I come back for checkup? Come back the next 6 months or 1 year, or it is at the pre starting, or you are okay now. Come back again. Let us make sure that you are still okay. So the person is, if it's worse, that these stages of grief, it will come. You deny it. The first is the denial,
Acceptance.
Bargaining, depression, and then you go. Now, so. But first of all, where does this lead me? The doctor or whoever health worker will advise you accordingly. Stop this medication you are taking. This is what is causing it. Stop this drink you are taking. Stop this or keep still start doing this or come again. Or it is age. This is age related. It worsens with time. But these are some drugs to give you to help. Oh man, this one is treatable. Just go take your medications and you get better. Okay, so but most especially have a treatment plan. Ask questions. If it's one that is a specialist, go see a specialist. And then if there are 2 or 3 modes of treatment, it's medical.
Okay, considering treatment options.
Options. This is better, but you can still go with this and still get the end result. When they take time, when they come with a little complication or distress or autonomy. Every patient decides what does she wants, what the doctor should advise.
Okay. Dr. Peter, Dr. Uche mentioned where he was talking about screenings, the fact that maybe you're in a community and you are not friendly with the next community and you need to assess the hospital there, but because you're not friendly with that community, you can't assess that hospital. So what I want to ask is, what initiatives do you think communities can actually take to ensure that people of their community have access to basic health screenings?
Okay.
Especially in this kind of scenario that he painted.
Yes, the truth is that scenario do occur. I know somewhere, a general hospital, where you could see that people from the other neighboring town find it difficult to visit that particular hospital just because they are having issues. And obviously they do have issues. So nobody wants to lose life when he's looking for health. So one of the things that should be done is that the community need to come together and support the government. How do I mean? In every community, you could see that there is public health center, and some villages don't care, some community don't care. They feel they cannot access care here. Meanwhile, if there is no hospital in your town, maybe in the neighboring town, you think people are having issues with that community, you can check the other community. But before doing that, I've said the community should support the government to protect whatever they have. You could see that some health centers, when you enter there, you notice it's dilapidated. The community will don't care to rehabilitate it, because the government will not give you wife and still give you mattress for you to make use of. So they've given you health center, people should protect it, help to equip it. There are wealthy individuals from each community. These people can come together and help to equip their health centers. If they can also build institution, hospital, to help their community, that's also a welcome idea. You mustn't wait for the government to do everything for you. So you don't just rely on that and then say the other community, you wouldn't want to go to that community because that's the only place you can find help. Yeah.
Okay.
But that's every community should have their own now. If that's the case, you have every clan, the Igwe or the PG should have a health center.
Yeah.
Or have a mobile clinic, or invite the hospital to their own square, and if it's weekly or monthly. Although I'm not a fan of quarrel, but in human existence,
There's bound to be that.
Find a way to settle, but health should not get to. It is you that is going to suffer. That I know we don't go to this community, but I want to go and take medication.
Curious, but some
When I
people
come back, I pay the fine. If it's 10,000, you stay alive and make that 10,000. And you should own your health. You don't because of religion. We don't go because of the particular church. As you know, I'm sure we've grown
past that age. Yeah.
But the community should do a radio jingle, invite mobile clinics if it's both. Once in a while, gather in a village square, do our checkup, do education, promotion, and I'm sure.
Talking about mobile clinics, if it's something that is adopted, can it actually change this narrative of people not going for regular health checks?
Yes, like I told you now, the environment, rainy season is very soon going to be
and for people to have access from different rural areas into the towns.
They come antenatal, prenatal visits, they come and, it will help. On a particular market day, let them go to the market and check free screening, BP, whatever, perhaps smell, collect sample, collect urine, for chlamydia, then.
I want to ask, what about you health workers?
Yeah, excuse me, we'll get to that. I want to advocate for those who actually say we don't go to the other community, maybe because of one issue or the other. That kind of mentality should begin to go down. You don't joke with your health. There's no how you will have a health challenge and there's hospital in the other community. You're not going to that community to begin to negotiate with the community people. You're actually going to a hospital where you will see health workers from other communities. So you're not going there to meet those other communities. Maybe you're afraid of. You are going there to seek
hospital.
for help. Just go there, you meet the doctors, do what you want to go and go home. The only issue here is that I know that there was this, I think that was last month or thereabout. There's a community that was having issues with the neighboring community, and that issue was just active that period. So you cannot be moving anyhow. So I understand that. But when the issue calms down, you can go visit the hospital that you want to visit. You're not visiting the village, you are going to the hospital. And that hospital serves for people within that area.
In the village.
So it's not owned by that particular village.
Unity is making it the reason why there will be peace.
They can also bring
Because
peace.
if you go there, you can now bring people that say, this man has got, let's settle this.
That kind of
whatever,
thing.
and,
Okay, we've talked about communities, we've talked about employers, we've even talked about how employers can also encourage their workers to be
Yeah.
going for regular. What about you, doctors? What can you guys do to change the narrative? Your own role. Can doctors offer free health screenings, or must you always come to the hospital and spend money? Don't you think it also discourages people from coming for routine health checks?
Incidentally, the Nigerian Governors Forum have, at least for hypertension and cancer and diabetes, there's a program they're doing now for free screening, mostly in the government, primary health care, and general hospitals, not in the mission or private.
Okay.
Yeah, but for us, sure, when we do our NMA Physicians Week, we do free
Screenings?
screening, we do free medical outreaches, especially give glasses, do surgeries, even minor invasive
Surgeries.
radiography and treatments. Once someone can just come and we'll find out what's wrong with you, and we do, but it's limited to resources and manpower. So we encourage even this I'm doing now, a 1-hour program. I'm sure it's up to $100 doctor per hour. What is going free of charge? So
Okay,
it
this is it.
Yes, that
This
is
is your,
it.
yeah,
So,
this is your
but there are some people that come when they come for checkup. I'm sure they bring me orange or banana. I look forward to seeing them. And when they bring it, some people come and give it out too. It depends on you have a good relationship with your client and you, doctor. As a man, each time he comes, I'm sure I'll tell him to wait. Let me finish seeing every other person. But we'll talk politics, we'll discuss soccer, I'll just say, okay, come next month. He'll be like, I should give me drug for next month. I said, no, I'm giving me drug for 2 weeks. But I don't want the drug finishes 2 weeks, he will come. Well, I say home is that he wants to always come around. He's this close. Even if he's fast, there's this joy interacting with people. You can drive and go and see your doctor. Even as a doctor, you can drive and go and see your patient. I will not see you, how are you doing? I'm passing by. I'll be like, hey, doctor, it's true, I'm supposed to come tomorrow. But since you are here, see what I'm happening. Arthritic pain or lumbago, anything, especially depression, anxiety, these periods of economic or fever, So we do our own at the scope of resources at our disposal. And mind you, if you're alone in the hospital, you may not be able to go down. So the manpower should be there as well. Spacing, leave, rest. Some doctors work in Nigeria, and some doctors work 8 hours and the next day, and the next day, and the next day. So.
And if the doctors are burnt out, they can't help their patients.
Yes. So when they come, they tell you if you don't have any problem, just go to check up, just go.
I would want to add something to that. I know some doctors who do yearly free medical checkup for their people.
Wow,
This
nice.
is still part of it. Professor Emegako, the general surgeon, he does that yearly in his hometown. It's still part of it. Surgeries and other things are being conducted. Some other doctors do that too, one Professor Mora and whatnot. So it's also cues into the doctors helping. There are many other ways, like he's explaining. There are many ways people come, just do it, even when they are not paying you a dime. Just do it just for doing sake.
Okay. All right. So in conclusion, Dr. Keke, what message do you have for people who have never gone for a health checkup before?
Health is wealth. That's longer. It is never too late to start. It may be late, but not too late. Pray, take a decision, go out, go meet that doctor, talk your problems out. Life changes, lifestyle modification. Most of these silent diseases kill us. have a propensity to get worse with our lifestyle.
Certain lifestyle, yeah.
Sleep, exercise, take
It's healthy.
less drugs, take less supplements, take less concussion, herbal concussions. Don't starve yourself to death. Pray mindful prayer. It mustn't be 12 to 12 or 6 to 6. Eat when necessary. Eat healthy. Step out. Go and meet doctor. Take your medication when needed. Don't overdose. Don't abuse. And then live healthy.
Basically, what Her Excellence is advocating for. What about you? What message do you have?
Okay, yes. Health is wealth. And the earlier, the better. For any chronic illness that you don't know about, if it is in you, you may stand the chance of surviving it if you come to the hospital early enough for checkup. But as far as it is in you and you never came for checkup, when it will begin to deal with you, it will be too late. So the earlier, the better.
Okay. Well, you've heard from the doctors in the house. Your health is your most valuable asset. And, they always say that prevention is better than cure. And it's good for you to understand that regular medical checkups are not just for those people who feel unwell, but rather they are a proactive step towards detecting potential health risk early and avoiding serious complication. Many silent killers like high blood pressure, diabetes, and cancer often show no symptoms until it's too late. That is why it's important that you decide to start routine health checks that can help detect some of these silent diseases and also help you to live a longer life. Remember, Nonya's Healthy Living Show, it's about advocating for healthy living. So, take your health seriously and go for health checkups. If you feel a certain type of way, see your health practitioner. Like you've heard them say, it's good for you to check online once in a while, but just know the sites that you're checking, and even after checking, it's always advisable that you go back to your healthcare provider. I'd like to thank Dr. Uchenna Terry Okeke for lending his voice to this very important conversation. Dr. Uchenna, thank you for coming today on the Nonya's Healthy Living Show.
Yeah, thank you, the presenter.
Thank you. All right, we also want to thank Dr. Peter Anirobi. Dr. Peter, thank you for making our time to be with us today on the Nonya's Healthy Living Show.
Thank you. Thank you for having me.
It's a pleasure to have you. Oh, well, remember that to live healthy is to live happy. And tomorrow is another day to stay fit and stay healthy. So see you at the stadium this Saturday. Healthy living is to go. I am Priska Nwankwo. We'll see you next week Friday.